And usually it begins with acute episodes of pain, sometimes from big injuries and traumatic events, and sometimes just those sudden spontaneous onsets of waking up with a really sore neck or bending over and suddenly feeling pain in your back. But it often starts with these kind of episodes of pain, and for whatever reasons our body doesn't fully recover. We don't quite get back all of our sensory and movement systems to the level they were before. So now we move away from that painful episode, but we're a little less of a complete mover than we were before. We have stopped turning our head fully in one direction, or we have slowed our head movements in order to cope with the pain that we're getting in our spine. And in some way, shape or form, we move forward in life from that painful episode a little less complete and a little less able than we were, but not enough for us to notice it at that stage. And then something else happens, we have another painful episode, or we pick up another injury, and again we come out the other side of that episode with a little less capacity within our movement systems, and perhaps as pain starts to build up, we stop being quite so active. So now we have rising threat from our sensory motor system, and we have falling capacity from our overall kind of robustness as a biological organism. And that's what it takes to get stuck feeling in pain, is threats too high and capacities too low. And then from there we'll just get to a point where we end up essentially biologically stuck in survival state, where our body is limping through the day, not well enough to move in ways that help to restore lost function, and not sleeping well enough for healing to occur within our body. And that gets us to a point where more days are painful than are not painful. Movement is more often guarded and slow than it is quick and thoughtless and fearless. And that, in a very brief nutshell, is the kind of story of so many people, is bouts of pain and injury that cause small compromises that cumulatively build threat within you as an organism. In response to that, you rightly lower activity to stop pain from occurring, but over months and years that's lowering the capacity of you as a whole organism. And when capacity is low and threat is high, it is the right evolved biological response for your body to feel persistent pain and difficulty with movement.